Madam, on 27 August 2016, Singapore detected its first confirmed case of locally transmitted Zika virus infection. As of noon yesterday, 333 persons have tested positive for Zika, including 8 who are pregnant, and involving 7 clusters. Most of the patients have since recovered and are no longer symptomatic. Although we had been expecting it, many Singaporeans were concerned when Zika cases first emerged in Singapore. The anxiety is understandable given that Zika is little known here. We have learned much over the last 2 weeks. Allow me to give the House an update on the situation. First, what is Zika? Zika is not a new disease. The first documented case of Zika was in Africa in 1947. The first reported large outbreak occurred in 2007 in Micronesia. Zika was unknown in the Americas until last year, when a number of cases were reported in northeastern Brazil. By now, 72 countries and territories have reported evidence of Zika virus transmission. On 1st February 2016, the World Health Organization, WHO, declared the recent cluster of microcephaly cases in Brazil, which are suspected to be linked to Zika, constituted a public health emergency of international concern. Zika is transmitted via Aedes mosquitoes, which can also carry the dengue and chikungunya viruses. Zika can also be spread through sexual transmission in some cases. About 4 out of 5 infected with Zika virus will not have symptoms. They are asymptomatic. The rest will mostly have mild symptoms, which include fever and rash, and other symptoms such as red eyes and joint pains. On rare occasions, patients may also develop Guillain-Barré syndrome, or GBS, a disease that temporarily affects the nervous system. Zika is, however, of concern among pregnant women. A small number of babies born to pregnant women with Zika infection may develop microcephaly, a congenital condition that affects the development of the brain. Research is still ongoing to better understand the association between Zika and microcephaly. We had expected Zika to come to Singapore sooner or later, given the large volume of travel in and out of Singapore. When it did, we also expected to see local transmission because of the presence of Aedes mosquitoes here. Hence, we have put in place an action plan with a 3-pronged approach. First, preparing for Zika. Second, responding to the initial cases. And third, managing Zika in the long term. Let me first talk about preparation for Zika. We prepared for Zika on a few fronts. First, MOH worked with the NEA's Environmental Health Institute to put in place a Sentinel surveillance program for Zika 2 years ago. We partnered about 200 clinics island-wide to collect blood samples from selected patients with symptoms associated with Zika, which are quite similar to dengue, and tested them for Zika virus. From January this year, we stepped up our surveillance and testing efforts and increased the number of samples tested for Zika to more than 500 a month. A majority of them are from people who had no travel history to Zika-infected areas. Close to 4,000 samples were tested between February and August before the first confirmed case happened. All the test results then were negative. At the same time, we strengthened our laboratory capabilities to facilitate the testing and management of patients. As a second layer of defense, we kept our doctors, especially our GPs, abreast of the development on Zika. Our GPs are the first line of care for most Singaporeans. They have been helpful in alerting us to unusual disease patterns, and we have also made Zika a notifiable disease under the Infectious Disease Act from January this year, so that MOH will immediately be alerted if any doctor or laboratory in Singapore detected a case of Zika. Third, we sought to reduce the risk of importation of Zika We issued travel advice to outbound travelers to Zika-affected areas and inbound travelers returning from these areas. Fourth, we stepped up public education and issued health advisories. In early February, we set up the Clinical Advisory Group on Zika and pregnancy to develop a health advisory for pregnant women and also to advise doctors on the clinical management of pregnant women with Zika. An interim clinical guidance was issued in mid-April. Fifth, we strengthened our operational readiness for an outbreak. In January this year, MOH worked with partner agencies to prepare our operational plans in case of an outbreak. In July, we conducted a multi-agency exercise where we simulated the import of an infectious disease into Singapore. This exercise involved a wide range of partner agencies, including Ministry of Trade and Industry, Ministry of Manpower. Meanwhile, we continue to monitor global developments related to Zika closely to obtain regular updates on the situation worldwide. Madam, on 12th May, a man was hospitalized after he fell ill upon returning from Brazil. On 13 May, he tested positive for Zika, and the patient was quickly isolated at the Communicable Disease Center at Tan Tock Seng Hospital. We screened the patient's household members, and NEA deployed a larger team of officers to conduct intensive vector control operations in the area around his home in Watten Estate. Residents in the area were given Zika information leaflets and advised to seek medical attention should they develop symptoms of fever and rash. We also asked the clinics in the vicinity to look out for Zika-like symptoms. The man was discharged after he tested negative for Zika virus and recovered. No other cases were subsequently linked to this case, and the virus was successfully contained. Then 3 months later, in the evening of 22nd August, Ministry of Health was alerted by a GP from the Sims Drive Medical Clinic on an unusual increase in cases of fever, rash, and joint pain that had tested negative for dengue and chikungunya. The next day, MOH arranged with the GP to refer new cases with similar symptoms to the CDC, Communicable Disease Center. On 25th August, that is 2 days after, we approached the supervisor of a nearby construction site for records of workers who had recently been unwell so that they can be investigated further. The following day, a lady visited the same GP clinic with similar symptoms and was referred to the CDC as was arranged with MOH. She was confirmed as Zika positive on 27th August. 3 other patients were preliminarily tested positive that day, pending confirmation tests. That very evening, MOH announced all 4 cases of locally transmitted Zika cases, 1 confirmed and 3 pending confirmation. Following this, we alerted the GPs in the Alginic Crescent and Sims Drive area to specifically look out for patients with Zika-like symptoms and advised residents in the area to see their doctors if they had such symptoms. NEA also intensified vector control operations in the vicinity. By then, MOH and NEA had moved beyond the surveillance phase to actively detect cases and identify clusters to manage the spread of Zika. To determine the extent and the location of the spread, we not only looked out for new cases, but also looked backwards in time to investigate past cases in the vicinity. As a number of such cases were construction workers, we went back to the construction site on 27 August to trace and test workers who had recently recovered from fever and also assessed and tested new patients. We obtained most of the results by the next day and included them in our subsequent announcement. This active backtracing was why the number of confirmed Zika cases increased from 1 reported on 27 August to 41 on 28 August. This sudden jump was surprising to some people who wondered if these cases had in fact been detected earlier but held back by Ministry of Health. In reality, the number of confirmed new Zika positive patients, and I repeat, new Zika positive patients, increased only by 5. The other 36 were from our proactive back-tracing of workers at the construction site. Many of them have already recovered from the sickness. Through the back-tracing, we also asked patients about the onset of symptoms to determine the epidemiology of the outbreak. The analysis showed that the earliest case had onset of symptoms on the 31st of July. Some people misinterpreted this as MOH having known of the first Zika positive case since 31st July. This is not so. As I explained, we only confirmed the first locally transmitted Zika case on the 27th August, and we released the information the same evening. We subsequently identified new clusters beyond Aljunied and Sims Drive, and we provided updates daily. Associate Professor Daniel Goh asked how we manage construction sites and dormitories. MOM and NEA have stepped up the engagement of construction sites and dormitory operators to intensify the vector control efforts to prevent mosquito breeding. MOM, Ministry of Manpower, has also reminded employers and dormitory operators to encourage workers to seek medical attention and notify their supervisors should they feel unwell. Measures such as temperature taking have limited effects for Zika, since a majority of the infected individuals are asymptomatic. That means they do not have a temperature. As Zika is a mosquito-borne disease, the key strategy is vector control. I would also like to assure Professor Goh that our primary healthcare system are all accessible to foreign workers should they need to see a doctor. The cost of their treatment will be borne by their employers. Let me now explain our approach towards Zika going forward and how we are going to manage Zika in the long term. As more cases and clusters emerge, our efforts are focused on vector control. Minister Masagos will speak on this later. Isolation of patients has limited effect as, firstly, 80% of those with Zika are asymptomatic. That means they have no symptoms. And secondly, there are already mosquitoes in the community carrying the virus. Hence, we now no longer isolate patients. Hospitalization of Zika patients is also not necessary, as we have found that most cases here have mild symptoms. Patients will be hospitalized only if it is clinically necessary. We had also reviewed our policy on the testing of suspect cases. Initially, we were focused on the clusters in order to quickly assess the nature and the extent of the outbreak to guide our strategy. We therefore provided free testing for those with symptoms who lived, worked, or studied in the areas that are affected. As more cases were found in other parts of Singapore, we extended Zika testing beyond the clusters and now provide a subsidy to all Singaporeans with Zika-like symptoms at the public healthcare institutions. Many pregnant women are understandably anxious about Zika. We are paying particular attention to them because of the possible risks of their fetuses if they are infected by Zika. The Clinical Advisory Group for Zika and Pregnancy had on 30th August updated its guidelines on the health advisory, testing and clinical management for pregnant women. These were aligned with the WHO guidelines, which advise that Zika testing for asymptomatic pregnant women is not routinely recommended. However, WHO's guidelines do recommend testing for symptomatic pregnant women and those whose male partners had tested positive for Zika. Symptomatic pregnant women and those whose male partners have tested positive should seek the advice of their doctors. They will be provided with free Zika tests at both public and private healthcare institutions if their doctors assess that testing is needed. Pregnant women who are tested positive for Zika will be referred by their doctors to an obstetric or maternal fetal medicine specialist for counseling and subsequent follow-up. Regular ultrasound scans will be carried out to monitor the development of the fetus. Zika infection does not always result in abnormal fetal development. It is therefore important that pregnant women be appropriately advised and monitored by the relevant specialists. Babies born with microcephaly will be supported and cared for just as we do for babies with other congenital conditions. People's Association has also worked with NEA and specially arranged for insect repellents to be available to pregnant women at community clubs island-wide since last Saturday. We hope this is helpful. Mr. Christopher D'Souza and Mr. Peng Eng Huat asked how we could raise public awareness of Zika. Public awareness is one of the most critical elements in our fight against Zika, and we have undertaken multiple efforts on this front. Since January this year, we have kept the public updated on Zika development through the media and the MOH website, providing information on precautions to take when traveling to Zika-affected areas. Since 27 August, we have shared information with the media and public on a daily basis. I would like to thank the media for following the news closely, taking the effort to understand the issues, and presenting the news on Zika in a clear and accurate way. The Ministry of Communications and Information, MCI, has set up a microsite on Zika with useful and easy-to-read infographics and videos on what is Zika, providing advice to pregnant women as well as the latest update on Zika situation in Singapore. MCI has produced some interstitials on Zika, which have been broadcast on free-to-air channels starting from last week. NEA has also set up a website with statistics on Zika infections and the clusters. NEA, in collaboration with the grassroots, has continued its outreach to the community through information leaflets and posters on Zika and dengue. This has gone hand in hand with their vector control operations. In Choa Chu Kang, for example, where I was and still am, with the support of NEA, students from the Pioneer Junior College and IT College West, grassroots leaders and volunteers, we visited 134 blocks in my constituency on 4th of September to share with residents information on Zika and what they can do. And I'm sure many other members have done the same. I have no doubt that we will be able to learn more about Zika virus through global and local research efforts. The National Public Health Laboratory has worked with A-STAR's Bioinformatics Institute to complete the sequencing of the Zika virus found in 2 patients here and shared their results publicly. We cannot tell at this moment whether the viruses found here cause more or less severe disease than those in South America. Further research will be needed to shed light on this. We can also expect more test kits to be on the market in future. They will need to undergo field trials, be validated by laboratory professionals, and approved by the regulators to ensure they are safe and results are reliable before they are available for use. Currently, there is no specific antiviral treatment or approved vaccine for Zika. Early-stage human trials have commenced for experimental vaccines. There are also ongoing research efforts in Singapore on Zika, but testing and translating these to practical clinical use will take time. Mr. Alex Yam asked whether the ministry will consider setting up a national Zika registry. We will study this carefully. Meanwhile, we are already tracking Zika, which is a notifiable disease. Microcephaly has been tracked by the National Birth Defects Registry since January 1993. We will work with our doctors to monitor the outcomes of babies born to women with Zika over time. Ms. Tin Pei Ling asked if there are useful insights learned from managing and communicating the latest Zika incident. I would like to share 3 learning points. First, it is important to be transparent and timely in sharing accurate information. This is why we release regular updates on Zika in order to keep the public apprised of the situation. This also prevents rumors and untruths from spreading and creating confusion and suspicion. Second, a whole-of-government approach is key. The Ministry of Health and Ministry of Environment and Water Resources are grateful that we have had strong support from our healthcare partners and professionals, government agencies such as NEA, MCI, MOM, and the People Association in responding to this outbreak. Lastly, but even more importantly, a whole-of-government approach is still not enough. We need a whole-of-society approach, and I'm grateful to many grassroots leaders and volunteers who helped to reach out to fellow residents on Zika, and I want to thank all Singaporeans for helping us on the ground to eliminate mosquito breeding sites. Madam, there is still much to do, and all of us need to play our part in the fight against Zika. It is still early days to ascertain what the long-term trend of Zika infection will be. We cannot afford to be complacent, even if we see day-to-day numbers coming down. Even as NEA continues its vector control efforts, each one of us should do what we can to reduce the spread of Zika by taking personal precautions against mosquitoes and checking for mosquito breeding in our homes and our workplaces. And I urge all Singaporeans to continue to remain vigilant and do our part to protect Singapore against Zika. Madam, the journey in our fight against Zika is likely to be a long one because of the presence of Aedes mosquitoes here. Even if we can control the present outbreak, we will need to continue to guard against imported cases, as the Zika virus is still circulating among many countries, including several in this region. Therefore, as we tackle Zika, life must go on. And by working together, I'm confident that we can succeed in managing Zika in the long term. Thank you.